Hi, everyone. This is our Women's Health and Menopause class. This will be presented live as well as uploaded to our YouTube channel. This is meant to be kind of a overview of different subjects that people may have questions about. If you have more in-depth questions, we're always happy to set up a consultation in person. So let's get started. To introduce, I just wanted to talk a little bit about talking with your provider. I know a lot of times people go in and aren't really sure where to start, and it really helps to advocate for yourself, to remember to ask questions, to have some idea of what you're looking for up front. If you're wanting to specifically talk about hormone therapy or symptoms you're having, it helps to make a list and be very open and honest with your provider so they know exactly what you're dealing with as far as symptoms go and what you're looking for. And also it helps to know like what treatments you're really not interested in. Like if you're against hormone therapy for whatever reason, that's okay too, but you need to be upfront about that. So what is women's health? Women's health encompasses the entire body and mind. So mental health, sexual health is important. It's not something that's widely talked about. It's kind of a taboo subject, but it's something you should be able to talk with your provider about if you are having concerns. Reproductive health, of course, your physical health and your emotional health are all important. What are some common women's health issues? There are a lot of things you wouldn't think of. Like I said, libido being one that seems like a taboo subject, but if you have a provider that you can be open and honest with, you really should be able to talk to them about libido and your concerns, because your sexual health is important to your mental well-being. It helps you connect with your partner. And, you know, there's always the caveat of being safe. Other issues, cancer, stroke, depression, anxiety. Autoimmune disease is something that is becoming more prevalent for whatever reason. I don't think we really know. But inflammation, eating disorders, heart disease, and then, of course, reproductive health. So that spans the entire lifespan of being a woman, right? Like you start out with starting your period as a teenager, going through young adulthood, having babies, managing birth control, managing periods and cycles and different, illnesses that go with that, like PCOS, and there's just a gamut of things that can affect you as a woman. So you really have to be comfortable with discussing every aspect of that with your provider. So getting back to why is it important? Well, obviously we make up half the population. We have unique health needs. Nobody is a stock one thing. Like everybody's women's issues are different. But not only that, if, seeing women as caretakers, or providing for their family, their health can impact the health of their children, their families, their communities, their workplaces. And so it just continues on in a cycle. Tips for maintaining good women's health. And this applies to everyone, of course. But since we're talking specifically about female health here, what are some things that we need to do and things that we're responsible for? We have a responsibility to ourselves to get regular checkups, to manage stress, whether that be through therapy or self-care or relaxation techniques, or, taking time to take a walk or ride your bike. Eating a healthy diet, avoiding tobacco use. I can't stress that enough, that there is really not any good reason to be smoking anymore. Limiting alcohol use, exercising regularly, getting enough sleep, and practicing safe sex. And sex tends to be such a taboo subject, like we mentioned before, but it really doesn't need to be. It really just needs to be a decision that you make for yourself and talk to your provider about, and knowing what your options are, because there are so many. And then when you get to the point where you're nearing perimenopause or menopause, knowing how to make that still be something that is enjoyable for you and stress relieving for you. So going back to how to talk to your provider, the main thing is being assertive. I know as a provider myself, we appreciate when people ask questions, when they have things in mind that they're willing to do, things that they're not willing to do, when they express their feelings up front and discuss things they feel are important. Keeping your healthcare records and making sure that we have updated medication lists and histories, and surgical histories is very important. And now we have all these patient portals you can utilize that will help you to keep track of all of those things. I know as far as menopause goes, there are some genetic testing that you can get if you feel your family history warrants it. That's something that you need to be open with your provider about, especially if you have a history of ovarian cancer, uterine cancer, breast cancer in your family. There are genetic components to that sometimes that would affect whether you can do hormone replacement therapy. So that is something that we need to know about. Family history in any situation plays a huge role in any kind of, like, heart history is huge. Like, you can have the most fit person who exercises regularly, who eats a perfect diet, if that's even a thing, and their family history can haunt them as far as cardiovascular disease goes. And so that's something that we want to know a lot about. And if you happen to be adopted or don't have access to that, I mean, that's something that we can overcome with some genetic testing as well. The biggest thing I encourage patients to do is make a list of symptoms that they're having, concerns they want to discuss, things that they've read on the internet. And I know, you have to take the internet with a grain of salt, of course, but there are a lot of reputable websites and books that make it possible for us to get information easily on the internet. And if you're reading things that you have questions about, there's no reason to not bring that up. If it's something that we need to debunk or something that is misrepresented, then we need the opportunity to talk to you about that and explain how things really are. So going into perimenopause. Perimenopause typically starts in the 40s or 50s, depending. It can last several years and is characterized by hormonal fluctuations that lead to a lot of physical and emotional changes. So this is when you start having your irregular periods, hot flashes, night sweats, mood swings. You may find that your libido decreases. You may have more vaginal dryness. Some women even report painful sex, and all of that is something that we can manage. So reminding yourself that this is a normal change, even though it is very frustrating, it can be very daunting. Really getting to know your provider and who is going to care for you during this time is important so that you're getting the best symptomatic relief you can get. So a lot of healthcare providers offer different things, and we'll go through all the options as far as medications go. But there's also that component of you need to be caring for yourself, reducing stress, going to get a massage, going to get a facial, taking time out for yourself to take a walk, any, yoga class or anything that really makes you feel good about yourself is important. Buying a new outfit, getting your hair done, like those small things really go a long way when you're having symptoms. So, little known symptoms of perimenopause that people kind of just attribute to life in general: anxiety and low mood, brain fog, insomnia, fatigue, joint pain, panic attacks, and palpitations. I know from experience with patients and my own experience that the anxiety level can really get out of control during this period of life. And I think, I don't I think a lot of it comes from the hormonal fluctuations, but also, your life is changing, your parenting years are coming to an end. And I know for myself, that's been a big issue mentally, is just accepting that your children are growing up. And those are the kind of things that having a good therapist is also important for. Many women, when they get into this perimenopausal state, think they're suffering from an acute illness. So they may present with just generalized symptoms to their provider. And I know a lot of people feel like they get blown off. And so arming yourself with this information on your own is really important, so that you can say, hey, could it be this? Because we can't think of everything, but we can try and help you sort through it together. It's got to be a team effort. Ask early about hormone replacement therapy, because it can reduce symptoms, and hormone replacement therapy, when used correctly, does have a protective effect on the cardiovascular system as well. So how do you know if you're in perimenopause? Menstrual bleeding becomes less and less often or more irregular. Symptoms such as hot flashes usually begin later in perimenopause, so you'll notice the period changes sooner. There are other illnesses that will need to be ruled out based on your symptoms. Hypothyroidism, autoimmune diseases, and anemia, all of those can present some of the same signs and symptoms. So those are things that, if you have a provider who's just telling you this is a natural change, you just need to get over it, you just need to accept it, but we're not ruling out other illnesses, this is a chance for you to advocate for yourself and say, hey, what about this? Do I need to have some labs done? I don't feel that we've investigated this angle, and have them listen to you. There's no discrete test for perimenopause, because your hormone levels aren't to the point where they would be in menopause. It's more of a subjective diagnosis. So again, it's just ruling out that it's not something else, basically. So talking about menopause, as far as what affects when you go into menopause, there are a lot of different things, and we'll just touch on them. Genetics, what other women in your family have gone through, your reproductive history, race and ethnicity plays a part, your weight and body mass. I know healthy weight is a struggle, and that's a whole other topic that we can discuss. Cardiovascular health, physical activity, and diet. Smoking actually causes early menopause. History of traumatic sexual and physical abuse and trauma, PTSD, can cause early menopause. And that is a link that I know they are still studying. It's very interesting. As far as your mental health and your past history goes, but it's something that you should be sharing with your provider. Oral contraceptive use and hysterectomy. And to touch on hysterectomy, it's becoming more common that women have had hysterectomies younger. There are different types of hysterectomies where they leave the ovaries behind so that you don't have early menopause. There, of course, is the hysterectomies that are done that take the ovaries, so then you're immediately in menopause and they start hormone replacement therapy right away. There are hysterectomies that leave the cervix behind, and so you need to be aware of what kind of hysterectomy you've had in order to make sure that you're having your yearly testing. Like if you still have a cervix, you still need a pap smear, that kind of thing. If you still have ovaries, then a bimanual exam every 3 years is recommended, so that we check for masses on your ovaries and that kind of thing. So that's another instance where knowing your own history is very important, especially if you move or go to a different provider. Then you're going to need to make sure they're up to date on all of those things. Okay, the big M, menopause. So this typically happens between age 45 to 55, and menopause is classified as 1 year since your last menstrual period. So your menstrual periods have stopped. You're having more symptoms such as hot flashes, mood swings, sleep disturbances. And the more I read about menopause and learn myself, the more sleep disturbance is a big issue that people don't realize is part of menopause. And so there are a lot of remedies for sleep. I think actually we're going to be doing a class just on sleep. So stay tuned for that. But make sure that you find a provider who listens to you, helps track your symptoms with you. It helps to keep a journal of symptoms and when things are changing, and help you make informed choices. So don't wait until you're miserable with symptoms. Like I said, starting some kind of hormone replacement early is actually protective of your cardiovascular system and can ease the transition into menopause. Even if you're perimenopausal, there are ways to make you more comfortable. And there's no reason to be anxious or have a low mood or low libido and make your life harder when there are things we can do to help you. In addition to finding a supportive healthcare provider, lifestyle changes like balanced diet, regular exercise, stress management, staying connected with a community like a support group or friends that are going through similar, can provide emotional comfort. And there's a lot to be said for the endorphins that you get from regular exercise and a good group of friends. Like, that can make your life immensely better. What works for one person might not work for another, and that's where the journaling comes into play. You can keep track of treatments you've tried. You can keep track of relaxation techniques that work and things that don't work, and things that help your anxiety versus things that cause anxiety. And going back and being able to look at your triggers is helpful. But prioritizing self-care and giving yourself grace is the most important part of menopause. And it's a change that isn't always welcomed, but it is a chance to have some personal growth. So how do you know if you're in menopause? Menopause happens when ovarian failure occurs. Basically, like we said, 1 year after your last menstrual cycle, you are considered to be in menopause. Lab values can help determine if you're in menopause and how to better treat your symptoms. And basically, ovarian failure sounds very daunting, but all it means is that your ovaries are no longer producing follicles and producing sex hormones, and the menses stop. Average age of menopause is 51. Normal menopause falls between the ages of 45 and 55. Menopause does carry some risks, and that is where hormone replacement therapy comes in. Osteoporosis. That's when your bone density scans become important as part of preventative medicine. Coronary artery disease, insulin resistance, neuroinflammation, which goes along with the autoimmune disease, and all the studies that are going on tracking how inflammation affects our bodies and different points of life. Visceral fat gain, meaning around your tummy, is some of the worst place to carry fat. It goes along with insulin resistance, and it's very hard to get rid of. And then you put that with the loss of muscle mass. Muscle burns more calories than fat. So weight-bearing exercise becomes very important for your bones and your muscles, and reducing that visceral fat gain. So just to touch on the laboratory studies that we look at for menopause, there's the FSH, which rises during menopause. So FSH is the hormone that stimulates follicles and eggs to mature in the ovaries. During menopause, the reason it goes up is it's trying to get the ovaries to produce the eggs, and the ovaries aren't doing it, and it's kind of working overtime. So you'll see a rise during menopause. The LH is similar. It's a luteinizing hormone. It also rises during menopause for that reason. So the estradiol is your estrogen that decreases during perimenopause and is almost non-existent in menopause. So that is that level that's significantly dropping, and that's that hormone that we're looking to replace most often. Progesterone helps maintain the lining of the uterus during pregnancy, so that also decreases during menopause. And other things that we look at for general wellness, as well as to keep track of during menopause are your thyroid stimulating hormone, because, an underactive thyroid can cause a lot of fatigue and visceral fat gain and a lot of those symptoms that we attribute to menopause, but it's something that we need to keep an eye on and rule out as a cause of our symptoms, as well as a hemoglobin A1C, which measures your average blood glucose over a 90-day period, and it helps diagnose type 2 diabetes and insulin resistance, and also, keeping control of blood sugars and knowing where we're at with our metabolism is very important to managing symptoms as well. So, hormone replacement therapy. This is the big kicker. This is the one that confuses people, and this is the one that us as providers have the hardest time explaining, because there are a lot of misconceptions and ideas about hormone replacement therapy that are and aren't true. We're going to go through the basics, and then anybody who has specific questions, you're welcome to comment on the video or send us a message on our website as well. Types of hormones that we replace. There are basically 3 types. The estrogen is the primary estrogen excreted by the ovaries. Progesterone is the hormone produced by the ovary after ovulation and by the placenta during pregnancy to maintain the lining of the uterus and support the pregnancy. And then testosterone. We think of testosterone when we think of men, but women have testosterone as well. And a lack of testosterone or too much testosterone, like in the case of PCOS, plays a role in energy, mood, libido, muscle tone, and mass. And it decreases during menopause. So replacing some of that testosterone at a very low dose is important for some of those symptoms. There are different kinds of HRT and ways to get hormones. There are synthetic hormones that are made from chemical compounds, but the body, so they're not the natural hormone, but the body converts them into a usable form. These are usually our ones we get from regular pharmacies, bioidentical or plant-derived, and structurally identical to the hormones produced by the body. And then you have several options as far as compounded hormones from compounding pharmacies that tailor them to the individual and can put them in many, many, many different kinds of ways to use them. FDA-approved hormones are made by pharmaceutical companies under strict guidelines. They're not customized. They're basic dosing that are like cookie cutter. And so that's really a huge conversation that you have to have with your provider about what you're wanting to pursue and what the benefits and risks of each kind are. There are a lot of forms of HRT. A lot of this is done in compounding pharmacies. Obviously, pills are probably, if you're looking for the synthetic pharmaceutical FDA-approved option, that's what you're going to get. There's also creams that are FDA-approved, but compounding pharmacies can make so many different things: suppositories, patches, gel, rings, sprays, injections, pellets, lozenges. So there are a lot of options as far as your comfort zone goes, and specifically dosing those. There are times when it is not recommended to use hormone replacement therapy. So I want to touch on that a little bit. And this is where knowing your family history, and if that's not possible, getting some genetic testing is really important. Known or suspected breast or estrogen or progesterone sensitive cancers like ovarian cancers and uterine cancers, it's very important not to be on hormone replacement therapy. Undiagnosed abnormal uterine bleeding. So after you have had a year of no period, if you start having uterine bleeding again, that is a situation where a uterine biopsy or an ultrasound and some diagnosis needs to be made before you would do any hormone replacement. Active or recent blood clots, known or suspected pregnancy, obviously acute severe liver disease, and hypersensitivity. Obviously, if you have an allergy to any of the components of hormone replacement therapy, you would not want to use that. Natural remedies. Everybody is always interested in, what are some more natural ways that I can make myself feel better? and we've talked about a little bit of this already, but cardio and resistance training, weight-bearing exercise, gets your endorphins going, builds that muscle mass, protects your bones. Balanced diet rich in calcium and vitamin D is very important for any perimenopausal or menopausal woman because, again, it protects your bones. And an anti-inflammatory nutrition such as healthy fats, lean meat, antioxidant-rich fruits and vegetables, and fiber. And there are so many things out with fermented foods and probiotics and protecting your gut biome that go into that. Mindfulness practices such as yoga or meditation, therapy or support groups. I can't stress that enough. I know people avoid therapy for whatever reason or don't have time, and it's so important. It's not a failure on your part. It is something you can do for yourself. Frequent self-care, good sleep hygiene, avoiding napping late in the day, avoiding heavy meals close to bedtime, and I cannot stress enough, decreasing the screen time at bedtime. I am a huge hypocrite about not using the phone or TV in your bedtime, but your quality of sleep will suffer. Keeping a bedtime routine, sticking to a sleep schedule. I cannot stress to you enough how important sleep is for your mental health, for your physical health. And we will be revisiting sleep as an entire class because there are so many things that ties into it. So we're going to hit the taboo subject last of libido. I think libido is important to everyone, whether they admit it or not. And of course, maintaining an open dialogue with your partner or partners, I don't judge, about changes in your libido fosters understanding. It helps them be a part of the decision-making process, exploring new ways to connect emotionally and physically. So trying one of those card games for couples or a couples journal where you write back and forth. Those things all seem silly and time-consuming, but they really can bring you closer together. Couples therapy. I mean, you don't have to be in danger of a divorce or losing your marriage to benefit from couples therapy. Having that third party there to help you connect sometimes can be really helpful. Considering the impact of stress, sleep, and overall health on libido is crucial. So making sure that you're taking care of yourself, exercise, balanced diet, sleep. I mean, we've said that 1,000 times already. But it can help your overall well-being, which makes you have a better libido. Another thing that is touched upon is pelvic floor therapy. If you're having any chronic pain issues, bladder issues that make you have a lower libido or feel self-conscious, pelvic floor therapy is amazing for things like that. There's also times when women have like undiagnosed cystoceles, or they have incontinence, or they have interstitial cystitis, and pelvic floor therapy can help immensely with symptoms that make you feel more confident. There are also libido enhancers in the forms of creams and gels that are available and safe to use. Most of those we get from compounding pharmacies. They are very, very good for women who suffer from painful intercourse or dryness or difficulty having an orgasm. And those are all things that, again, you need to be comfortable with your provider and having that conversation and figuring out what might work and what you are willing to try. So there is a reading list. These are all great books that you can follow up on. One that I highly recommend is The New Menopause by Mary Claire Haver. She has a menopause toolkit for each symptom and different things that you can do. These are all medically based books written on, guidelines and standard of practice, and very, very easy to read and layman's terms. So I highly recommend picking up a couple of these from the library or your bookstore if you are starting to go through this transition and want to get more information. The Mayo Clinic book is great. Unlock Your Menopause Type is also very good. Highly recommend. As far as questions and answers go, if you have any questions or answers and would like to comment on the video, I will do my best to to reach out with answers. We also have our website, which is listed here. And you can send portal messages, private messages. You can message us on Facebook. We are happy to do consultations. Most of the consultations I do for sexual health or hormone replacement are free. So just reach out to me if you would like to discuss anything, and we will be happy to see you. Thanks again for joining our class.